Hello, I'm Dr. Brandt Gibson, and we talked about heel pain in children, or heel pain in a child, being something other than plantar fasciitis. In fact, it's usually calcaneal apophysitis or Sever's disease, which is an inflammation of the growth plate in the back of the heel. And we kind of mentioned in that video that there are some treatments that can be done for it. So if you have a child who has heel pain, especially if they have heel pain after running, so at soccer games or football games or basketball games or gymnastics, whatever, after they've been really active on them where they get really, really sore and they can hardly walk, there are several ways you can treat this. The old way they used to treat this is they'd say, okay, stop exercising, which is a stupid answer. That's not what you're going to do. That's not what your child's going to want to do. So that's not a good solution, and most of the time it doesn't fix the problem. Number two is they sometimes would put them in casts and so forth. Why? I don't really know, but that's also ineffective and not a good treatment. It will take the pain away. When you take the cast off and they start running again, the pain may not come back, but a lot of times it does. So what are your options to allow them to continue to be active, to allow them to continue to do what they're doing, but treating the heel pain? The best option is a type of plastic heel cup. This is a hard heel cup that will actually cup the heel. It'll hold on to it. What it does, it keeps the Achilles tendon from pulling away from the heel, so it keeps that pull and aggravation of the growth plate from happening. It also pulls the fat pad and puts it back underneath to pad the foot to get the natural padding that's supposed to be there. So what you're basically doing is saying, I'm helping this foot function like it's supposed to without getting as much trauma to the growth plate. And in most cases, probably close to 80% of the time, this will solve the problem. Now, the interesting thing with that treatment is we've even used it in gymnasts and in dancers. And in those cases, a lot of times you end up taping the heel cup on so that they can actually continue to do their things even if they have to be barefoot, and it still works. If this doesn't work, if they continue to have pain, continue to have discomfort, and this is not doing enough, the next option is to put them into a custom orthotic. The advantage of the custom orthotic is it will have that really high heel cup, so it'll do similar to what the heel cup is doing, but it will also change the way they're walking. And so it'll actually change the functioning of the foot to take the pressure off that Achilles tendon and off the function of the foot to allow it to get better. And in these cases, this will help resolve the problem. Now, in the meantime, you're saying, okay, I can't get the heel cups, I can't do this. The question is, am I doing long-term damage? No, it's a growth plate. You could injure the growth plate further. Most of the time, in this case, it's just an inflammation of the growth plate, and it's just very, very uncomfortable. And so anti-inflammatories, ice can actually alleviate it. The best thing to do is find a way to take the pressure off. And the way that we're doing that is through the heel cups or the custom orthotics. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 294, treatment of heel pain in children. You'll notice that it's not exactly the same. We don't do cortisone shots. We don't do any of those kind of things in this area because it is ineffective at treating the inflammation of the growth plate. And this is not, I repeat, not plantar fasciitis. Heel pain in children should be treated either with orthotics